You've just entered the No Delusion Zone. I'm David DeBatto. Today, my very special guest is Dr. Aubrey de Grey. Dr. de Grey is internationally recognized as the visionary biomedical gerontologist who devised the strategies for engineered negligible senescence, a comprehensive set of methods and strategies to rejuvenate the human body, thereby preventing age-related ill health and mortality. He's co-founded multiple nonprofit organizations, including Methuselah Foundation, the SENS Research Foundation, and Lev Foundation, to enable and accelerate its development in clinical translation. He received his BA in computer science and PhD in biology from the University of Cambridge in 1985 and 2000, respectively. He's the author of The Mitochondrial Free Radical Theory of Aging, 1999, Ending Aging, 2007, and a large number of academic papers. Dr. de Grey is a fellow of both the Gerontological Society of America and American Aging Association, and he sits on the advisory boards of numerous scientific journals and research organizations. He is a prolific speaker who regularly presents at conferences and events worldwide. And as I said, I'm very glad to have him here today. So it's with great pleasure that I welcome Dr. Aubrey de Grey to the No Delusion Zone. Welcome, Dr. de Grey.
Thank you for having me. It's great to be here.
Well, same here. As I said off air, I'm a fan. Most of my viewers are not scientists. A few of them are, but they certainly are all interested in science. Unlike the current, how shall I say, governments we have here now and prevailing winds, we do definitely believe in science. And so I'm excited to have you here. For the most part, I can speak for myself as well as some of my viewers. Issues or studies such as cryogenics and longevity studies are definitely top of mind. And in my case, I have to admit, I'm a sci-fi fan, and the topic of generation ships always comes up with me. I just think it's a great topic, not something that you're an expert in, but I just wanted to lay that out there. Let me ask you this, as you're asked in many of your interviews, why do this? Why is this important? And how did you get into longevity studies and when?
Yeah, so I mean, I think the extraordinary thing is that anybody would think that it's not important. We know very well that aging is the number one cause of suffering in the world these days. You know, it causes far more suffering and far more death than anything else, indeed everything else put together. So the idea that it would not be something that we would try to do something about, it just makes no sense at all. And that actually relates to the last part of your question. How did I get into this and when? It was about 30 years ago. Until that time, it had been so obvious to me that aging is the world's number one problem that I had never taken the trouble to discuss the question with anybody. I had just gone about my merry way, assuming that everybody agreed with that, everybody thought that. And it was only after I met and married a biologist who was a lot older than me. She was already a senior full professor at UC San Diego. That I found out, first of all, that she didn't think that way. And second of all, that, other people who were working on biology also didn't think that way. I had always assumed that the only reason one didn't really hear much about this kind of thing was because it was hard and therefore there wasn't much progress and wasn't much to talk about. But I'd never considered the possibility that people might actually not be trying. And that's turned out to be the case. So I thought, well, that won't do. And I had spent the previous several years, the early part of my career, working on artificial intelligence research, also for humanitarian reasons, basically because it's a bit of a shame that people have to do so much that they would not do unless they were being paid for it. We would do better if we had machines to do that kind of stuff for us. So that's what I wanted to do. But I always knew that aging was by far a bigger problem than the problem of work. And therefore, when I found out that nobody was working on it to speak of, I thought, well, I'd better switch fields. And I was in a fortunate position where I was able to do that in my early 30s, I guess. So, so here I am.
Let me ask you this, because for people like me, for whom this is a no-brainer topic, meaning we should be studying this and we should have for a very, very long time, why do you think the scientific community, especially biologists, back when you started this, say in the 1990s, 2000s, were not interested in this? Was it because it was too outlandish, sci-fi, or they just didn't think that it was worth studying? I mean, what was the reason for that?
So, I mean, I think the conclusion I've come to about that is that it's really just that scientists are the same as everybody else in terms of the psychology of aging. They know that the prospect of putting aging, you know, to bed, so to speak, in other words, finding medicines that keep it completely under control is a very tall order. And we honestly have no idea how long it's going to take us to achieve that, though we have a better idea now than we had back then. Um, and so people will just choose to put it out of their minds and get on with their miserably short lives and make the best of it rather than, being preoccupied by this terrible thing that's going to happen to them in the future. And of course, um, when you don't have a plan, when you don't even have a plan, you don't have any idea how to go about developing medicines that would bring aging under control, then, that kind of makes some kind of sense to think that way and put it out of your mind. Um, but some of us are not so defeatist, and so it never made any sense to me. I thought, well, okay, I mean, the fact that it's a hard problem doesn't mean we shouldn't be working on it. I think most scientists just felt the same way. Plus, also, of course, there's a career aspect to it, a professional aspect that, in order to, the whole career structure in science, in academia, revolves around progress. It revolves around publishing papers that report positive results and that at least purport to constitute, improvements in our knowledge. That's what you get promoted for. That's what you get your next grant application for. And so if you're working on something that's really, really hard, such that you won't be making much progress very often, then, that's kind of deprecated. The incentive structure is, is not uh, structured around that. And so for all these reasons, it's just been pretty hard to get scientists to do this. Back in 1993, so this is some years before I got involved in the field, a couple of years before, um, there was a huge breakthrough. A professor at UC San Francisco named Cynthia Kenyon found a way to double the lifespan of very simple organisms, nematode worms, which normally live about 3 weeks. Um, and she did it just by mutating one gene. Um, and now, in fact, we figured out how to get a factor of 10 on the lifespan of this particular organism. Um, the thing is that one breakthrough was so unexpected that actually, someone else made essentially the same breakthrough 5 years earlier and was basically just ignored. It had to be done twice for people to pay attention. But the point is, it did bring a lot of talent into the field because people suddenly felt that there was ways that they could publish papers, in this area and test hypotheses and so on. And so progress sped up a lot. The progress, I have to say, was not quite um, the right kind of progress. It was not prioritized correctly, but it was a lot better than nothing. So, this is what we needed. And now we're seeing the same thing again. We're seeing progress in the kind of things that really will work, essentially regenerative medicine, stem cells, gene therapy, and so on, against aging. And again, that's drawing more and more money and more talent into the field. So things are speeding up.
I have so many things I could ask you about, but if I asked you all the questions, you'd have to use rejuvenation technology on me because we'd be here for so long. You mentioned a breakthrough back in, I think you said 1993, the early 90s, involving a worm. Um,
Yeah.
it always amazed me, again, as a layperson, that not more scientists, again, especially biologists, back in the day in the 90s and even before, were not pursuing this field because, for example, you know, jellyfish right now are thought to be almost immortal. We're not quite sure how long they live. They self-replicate apparently. You mentioned the breakthrough with worms. To me, it would be self-evident that if there are organisms on Earth that can do this, why wouldn't some scientists at least be interested in trying to replicate that in humans? It always amazed me.
Right. And again, it's not so much they're not interested in trying. It's just that they have to decide what to work on the basis of these other pressures. So it's the combination of the two things I said. It's the pressure to get positive results and publications, and there's also the psychological pressure that they, as human beings, are under, same as the rest of the world is, just to put aging out of one's mind. Both of those things in combination, really make a difference.
Well, and that gets me to my next questions, and I'd like to talk to you about this, your foundations.
Mhm.
Uh, as I mentioned, you have founded numerous nonprofits, and specifically, if you'd like to talk right now about the Lev Foundation,
Yeah,
and how that came about, and really expound about what that is and the kind of research that you are involved in.
sure. So first of all, we don't call it LEV. We call it LEV, LEV Foundation. It's an acronym. It stands for, no, no,
Okay.
it stands for Longevity Escape Velocity,
Yes. Yes, I
which
should have
is a
said.
concept that I put forward about 20 years ago.
Mhm.
Um, no, so what are we doing? Well, what we're doing is actually a bit of a departure from what we were doing at my previous two foundations. And in order to explain the basis for the departure, I need to go back a little bit and talk about what SENSE is. This strategy for engineered negligible senescence that you mentioned earlier on. So that is a strategy for developing a panel of interventions, a panel of treatments that can be given to the same people at the same time and will comprehensively repair the damage that their bodies are doing to themselves throughout life, which is what aging is. It's the accumulation of self-inflicted damage. Um, now, the fact that it's a panel of interventions is the important thing here. This is a divide and conquer strategy. And like any divide and conquer strategy in any kind of branch of engineering or technology, there's two phases to it. First phase is that you develop the components individually, and then the second phase is you put them together and you get your overall result that you were aiming for. Now, in most engineering, that second part is the easy part. You kind of can guarantee that the thing's going to work if the bits work, right? However, in the case of medicine, that's not so, because the thing about medicine is that the system that we're trying to manipulate is a living organism, and we understand very, very little about how it works. We have a pitifully small understanding, really, about how it works. And so there's lots of potential for surprises when we do that second phase, the putting together of the components. So I've always been waiting to be able to start that process. Um, and now I can. Essentially, the components from 20 that I came up with like 25 years or more ago, um, they have a wide spectrum in terms of degree of difficulty of implementing each of the components. So some of them are easier than others. And the easy ones were the ones that other people were already working on when I started to have enough money to be able to fund any research at all. So I wouldn't want to fund those. I don't want to duplicate effort. I want to do the stuff that's being neglected, which was, of course, the more difficult part for which you couldn't get your, nice high profile publications that I was mentioning earlier. And that went pretty well over the last 15 years. We've made a lot of progress in a lot of different areas, include sufficient progress that half a dozen projects ended up being spun out as startup companies. So, getting far enough along in terms of proof of concept that at least the more courageous end of the spectrum of investors who actually want to make money were willing to get interested. So that was very, very heartening. But in the meantime, the people who've been working on the lower hanging fruit, the easier parts, have indeed also made progress. And in some cases, that progress has reached the point where in mice, it's possible to actually make them work and actually make them work to the extent of extending life, healthy life and total life of these mice. And the way you do the critical thing is you can do this starting when the mice are already in middle age. So putting numbers on this, normal healthy mice normally live to about 2.5 years on average. So we are interested in the case where you start treating these mice when they're already about 1.5 years old. So they're not sick yet, but they're not far away from becoming sick. All right. So first of all, you may be thinking, hang on, how would individual components that have been developed actually have an effect on lifespan? Surely they're only fixing one thing, you've got to fix everything. And that's kind of true. But the thing is that we should not be surprised when we to see a small effect, a mild effect on lifespan, because everything in the body is connected to everything else. If you repair one big type of damage, then you're quite likely to have knock-on effects and knock-on side benefits that indirectly slow down the accumulation of other types of damage. And that's indeed what we're seeing, which is great. So now that certainly does not in any way obviate the need to do this putting together part, because you've got, you might be slowing down the accumulation of some other types of damage, but you're certainly not repairing those other types of damage. So you're not rejuvenating the organism all that much. So yeah, that's what we've been doing at LEV Foundation. We've been taking a bunch of different treatments and putting them together in the same mice at the same time to see whether we can get an additive effect in terms of the rejuvenation and the consequences for lifespan. We
Now,
started our
no,
we
I was
started
going
yeah,
to
we started our first experiment of that nature 2 years ago. It's almost done, and we're very happy that we have indeed obtained additivity of the sort we were hoping for. So the next thing to do is to do it better. We did it with only three different rejuvenation interventions, plus also a drug called rapamycin, which we can talk more about if you like. Next time we want to do it with like 8, and we believe that we've got a good chance of getting really big results.
You take part, or at least your research in doing damage repair, as opposed to which you've talked about, as opposed to some of the other research, which and again, correct me if I'm wrong, and I probably am. Other research has been going into with humans, trying to make human beings live a longer, healthier life, or just a longer life, sicker. Again, I've got it all screwed up, but you're basically doing damage repair. You're not looking for immortality per se. You're trying to fix what we have now, and we will live healthier longer. Please correct me and expand on that if you could.
So that's broadly correct, but let me elaborate a little bit.
Sure.
So first of all, you're certainly right that I don't work on immortality, even though a lot of people like to say I do. It's just that I think that we are likely to end up with people who are alive today living a lot longer than anyone had ever lived before, simply as a side effect of keeping them healthy, right? And the way we'll keep them healthy is by this damage repair, this comprehensive, divide and conquer damage repair approach. So you're quite right that today the real, like, much more publicity goes to the kind of people who are focusing on optimizing what we can do already. Optimizing health span with lifestyle and diet and supplements and so on. And that's okay. I don't object to that. First of all, because it gets people thinking about aging at all. And second of all, because it is better than nothing. But it's not much better than nothing. People who are doing what can be done today will not get more than about another couple of years of extra healthy life relative to just living the way their mother told them to. And this needs to be not forgotten. If people start thinking that the fountain of youth already exists, the Holy Grail already exists, then they won't be focusing on what they need to focus on, which is the research that hasn't yet been done to develop treatments that don't yet exist that will do much, much better than anything that exists today.
I love a comment you made, and I wrote it down. I just think it's great. You said what's important is the link between metabolism and pathology, meaning being alive and being dead. I like that. Speak about that if you could, what you meant.
Yeah, so that's one of the things I've said in order to get people to understand what aging is in the first place. Because, it's crazy. Aging has been the number one preoccupation of the human race since the dawn of civilization. And yeah, if you ask 10 people for their definition of aging, they'll all get different answers. It's crazy. So I think it's very important to have a definition of aging that's, first of all, correct, and also that somehow demystifies aging and makes it possible to understand that we don't need to think of this as this enigma. It's an easy thing to understand. So, aging is simply the same kind of phenomenon in the human body or in the body of any living organism as it is in a simple man-made machine like a car or an aeroplane. It is simply a fact of physics, forget about biology, a fact of physics that any machine that has moving parts is going to do itself damage as a consequence of its normal operation. And every machine, whether it's man-made or whether it's a living organism, is also, therefore, going to be designed and built to, to be able to tolerate a certain amount of that damage without significant decline in function. But only a certain amount. Eventually, the damage is going to accumulate to a point where the machine's function does start to be impaired and eventually to cease entirely. So in just the same way that a car, will rust starting from the day it's built, and eventually the rust, well, for a long time the rust won't matter, but eventually the doors will fall off, in the same way, the human body damages itself in the course of its normal operation as a side effect of the processes that it needs to perform day in, day out just to keep us alive. And that damage is indeed harmless for a long time until there's more of it than what the body is set up to tolerate, at which point we start to exhibit the pathologies of late life. So aging is just this, if you like, this combination of two processes. The process that goes on throughout life, whereby our metabolism, this network of processes, generates this damage, these changes at the molecular and cellular level to the structure and composition of the body. And then there's a second process which kicks off late in life when that damage has accumulated to a point that's beyond what the body is set up to tolerate. And that's where we get these pathologies. So metabolism causes damage, damage causes pathology. And our goal is to ensure that metabolism does not cause pathology. So the big insight that I had was to realize what was the easiest way to separate metabolism from pathology. And essentially, people before me had been focusing on only two alternatives. One was to do it by separating damage from pathology. In other words, somehow making the body more resilient, and so it didn't get sick even though it was still accumulating damage. That's what I call geriatrics. And then the other approach was to separate metabolism from pathology by separating metabolism from damage, essentially making the body run more cleanly so as to generate damage more slowly. And both of those things turned out to be absolutely impossible. But I realized that if we go in and periodically repair the damage, then we are essentially separating those two processes from each other, and thereby we are separating metabolism from pathology, even though we are not actually interfering in either of the processes themselves at all. And of course, this is common sense, really, because if we go back to the analogy with simple man-made machines, this is exactly what we do. Comprehensive preventative maintenance, you don't have to understand or alter the chemistry of rusting in order to keep a car from having so much rust that the doors fall off. You just scrape off the rust every so often. I mean, come on. So this is all that we're about here.
You have another acronym. I love your acronyms and I love what they stand for. RMR, which is Robust Mouse Rejuvenation Pipeline. And I think it's what you're talking about now. And again, correct me if I'm wrong. You're talking about health span versus lifespan.
There you are wrong. That last part.
Okay.
It's very, very important to understand that there's no versus there.
Okay.
That because people think that way. People think, oh, there's a trade-off. That what matters is health span, and we shouldn't be focusing on lifespan, because and the reason people think this way is, of course, because today it's true that there is a trade-off in the sense that a lot of the things we enjoy doing are bad for us, right? So, quality of life versus quantity of life, there is a versus. But when we're talking about these medicines that will do this comprehensive damage repair, there's no versus at all. There, rather than health span being alternative to lifespan, instead health span is what confers lifespan. That lifespan is a side effect of health span, and that's really important to remember. So yes, I focus on health. What I do is I focus on health, but I celebrate the fact that it has this side effect that we're also going to live longer. So that's the important thing. So coming back to RMR, you asked about that.
No, I'm glad you clarified it, because I think why I said that is because it seems that that's where most of the research is today. Health span versus lifespan. Your research is not directed there, and you explain exactly why.
So actually, it's not. It's even worse than that. So most of the talk, most of the chatter that you see on the media and everything is about health span versus lifespan. It's about living better with supplements and lifestyle and so on. But most of the research is indeed, the researchers, they understand perfectly well what I just said, that lifespan is a side effect of health span. They just think it's politically incorrect to say so. So you don't get a lot of researchers out on TV, on stage and on camera saying that they're after increasing lifespan because they think it's going to be more palatable if they only talk about health span. And this is a shame because fact is, it's always better to be straight with people. Um, so anyway, coming back to RM market, you asked about it. So robust mouse rejuvenation is a, a kind of rather arbitrary milestone that I have put out there as to what we want to achieve with these experiments of the sort that we're doing at LEV Foundation. The idea is that we'd like to take mice that are a year and a half old and that would normally live one more year, and we would like to double that. We would like to get them to live 2 more years. So to an average age at death of 3.5 years rather than only 2.5. And the reason that that's a useful milestone to put out there is because it's a dramatic improvement on what we can do so far today. Today, there's no way to get a mouse that you've done nothing to at all until it was 18 months old to live more than 4 months longer than it would naturally do. We can get 4 months, but I want to treble that. I want to get 12 months, right? Now, why is that so important? The real reason it's so important, this is another thing that most of my colleagues in the aging research field have been studiously sweeping under the carpet, is that we've been able to do that 4 months for 50 years. We've made no progress at all. Now, all the researchers know that, and they don't talk about it because they want the people who pay their bills to carry on paying their bills. But the fact is, it's true, and they know it. And therefore, if we can get to 12 months, or even 8 months actually, but certainly 12 months, then every researcher on the planet is going to know that we are in a completely new world. I mean, this will be an absolute paradigm shift in terms of how we can think about the rate of future progress. And I believe it will be enough for my colleagues in the research community to come out alongside me and say the kind of things that I've been saying for a long time about timeframes, about how soon we are likely to be able to do the same kind of thing for humans, give them, let's say, 20 years of extra life. And that's when longevity escape velocity kicks in, but I will come back to that later.
The reason that your damage repair is probably going to extend the human lifespan more than some of this other research, and I've heard you talk about this, is not just that you are repairing the damage, thereby enabling humans to live healthier a little longer, but by living longer, they are going to be around when future developments occur, therefore expanding their lifespan even more. Talk about that for a few moments, if you could. I think that's brilliant.
Sure. So this is the concept of longevity escape velocity.
Mm-hmm.
And this is one of those very curious phenomena, very unusual situation where it's easier to do it for humans than it is for mice. Look, what we are talking about here is, as you said, buying time. Essentially, if we take people who are already 60 or so and we give them a sufficiently comprehensive panel of rejuvenation treatments so that they are essentially given 20 years of extra life, then what does that actually mean? It means that essentially they won't be biologically 60 again until they're 80, right? But the thing is, when they're 80, the reason they'll get to 80 again at all is because the treatments are not completely comprehensive. Call it damage repair 1.0, right? There will be a bunch of damage that it repairs. Let's call that the easy damage, and then a bunch of damage that it doesn't repair. Call that the difficult damage. And so, and you can have these treatments, these rejuvenation treatments, as often as you like. It's still not going to fix the difficult damage. So basically, by the time these people are 80, they're going to be entirely full of difficult damage, no easy damage to speak of. And that means that the treatments will have no effect. It'll be as if they weren't getting treated at all. So they will get sick and die, same as normal. It's just 20 years later. However, in those 20 years, people like me, the researchers, will have been grinding away, improving the treatments. So actually, when they're 80, they won't get the same treatments. They will get damage repair 2.0, which obviously still repairs all the easy damage, but it also repairs some of the difficult damage. Right. So that means we will be able to re-rejuvenate the same people um, when they're 80, so that they won't be biologically 60 for the third time until they're, let's say, 110, and so on. This is what you were saying. Now, that's why we'll never get to longevity escape velocity for mice, because if you are able to extend mouse lifespan by a year, you've only got a year to improve the treatments to do it the next year, and that's not long enough. So it's much harder for short-lived species than it is for long-lived species.
Well, that seems to me to be the key, the buying time, as you say, for another 10, 20, 30 years, what have you, because we will, like you said, people like yourselves will be making steady advances. And 20 years from now, you're going to have different cures. You're going to have the ability to repair more serious damage. And I think that is the emphasis or the focus of the people who do believe in cryogenics, not repairing anything, putting themselves in a deep freeze for 100 years and then wake up when things are, much more advanced as far as medicine. We haven't talked about that. I know that's not your field. Do you have?
Well,
Well,
I
no,
know
I'm
it's
sorry. I'd like to hear your opinion
yeah.
on
So
that,
I
though.
have so first of all, it's not called cryogenics; it's called cryonics. But
That's why I have you on this program.
Yes, all right. But actually, even though it's not my main field, I have been heavily involved with the cryonics community for more than 20 years. I very much believe that again, it's a tragically, criminally neglected area of medical research. Um, and of course, yes, you're quite right. It's not about repairing damage. It's about essentially buying time so that the damage can be repaired later. There's still a lot of difficulties with, I mean, technical difficulties with cryonics. Essentially, it revolves around the fact that the cryopreservation process inflicts a lot of damage. Obviously, you're going to the damage that you already have in your body that caused you to be pronounced legally dead. Um, but there's also damage that the cryopreservation process adds on top of that. And so there's a lot of work needs to happen to reduce that additional damage. And progress is being made, but not nearly as fast as it should be, because of course, lack of funding, same as usual.
Do you believe if there was sufficient funding, for example, the folks who are researching cryonics got all the funding they could possibly need, that this is or would be a viable alternative, that this would in fact work?
Oh yes, absolutely. I mean, well, okay, first of all, we have to define what we mean by working. Okay. So there are really two different scenarios. I mean, there's a spectrum, but it really falls into two main categories. Two different scenarios for the revival of people who have been cryopreserved. One of them is to be revived in the same way that someone who's in a long-term coma might be revived. In other words, essentially, in this case, you just warm them up and they wake up and bang, that's all great. However, because of all this damage that I'm talking about, that is really not going to happen to anyone who's been cryopreserved yet. It's not completely certain, but even the people who have been cryopreserved with the absolute state-of-the-art best quality, I would say they've got a limited chance. So you might ask, why are these people even being preserved at the moment at all? And you could ask even more, why would they have been preserved when the technology was even worse, like 50 years ago? The answer is because there's another way you can revive people in principle. You can revive them not in their current body, but as a kind of avatar. Basically you can slice and dice their brains and scan and potentially scan the brains at really ultra high resolution so as to figure out, the whole of their personality, what they used to be made of, what they used to think, what they used to feel. And create that. Now, most people would say that that's not really revival. That's just making a copy. Um, but some people don't think that way. So that's really a large part of why some people are still cryopreserved. However, coming back to the route one, in other words, warming people up, then absolutely, I believe that there's a very good chance. In fact, I would say it's virtually certain that with enough research, we will reduce the amount of damage a lot more than what's been done so far. and indeed reduce it to a point that is negligible when compared to the damage that the person died of in the first place. Um, and therefore, yes, absolutely. I think that it's criminal that this research is going so slowly because of lack of money.
With the criminal lack of funding, as you, I think, accurately describe it, how long would you say it's going to be before this is a viable approach?
Yeah, so I mean, with any pioneering technology, one can only give probabilistic timeframe predictions. And indeed, in relation to developing rejuvenation that's good enough to get to LEV for people whose hearts are still beating, I've been trying to persuade my colleagues to talk about timeframes, for a long time now, more than 20 years, and I certainly have been talking about them myself. But basically almost nobody will even give probabilistic timeframe predictions. They just feel they would be over-promising and under-delivering, and I think that's irresponsible, to be honest. I think that we have a duty as experts to give our predictions because otherwise people will make up their own prediction, which will be never, and things will be slower as a result because people won't be enthusiastic about improving funding for something that's never going to happen. So it's the same with cryonics. Um, but with cryonics, the breakthroughs that need to happen are probably a little bit more fundamental, and therefore the uncertainty of any prediction is even greater. However, the number of breakthroughs that have to be made is actually smaller. One or two breakthroughs would more or less entirely solve the cryopreservation problem. And therefore, in the case of aging, in the case of rejuvenation and getting to longevity escape velocity, I say that I think we have a 50-50 chance of getting there within the next 12 to 15 years, so the latter part of the 2030s. But we definitely won't get there for in the next 5 years. There's just too many things that we have to fix up. And also, there's maybe a 5% chance that we won't get there in 100 years because we hit all manner of other obstacles. So then if I try to give the same kind of spectrum for cryonics, I would say, again, 50-50 chance, maybe 15, 20 years, the same kind of order, right? But I would definitely not rule out getting there in 2 years, just because we've only got to make one or two breakthroughs, right? And equally, I would say that the probability of not getting there for 100 years is up around maybe 20 or 30%. Because there's so many new things that we could encounter. There's just been so much less research.
Those who do research and are currently working on immortality, some of them I've read say that aging is just a disease waiting for a cure. Do you agree with that statement?
Yeah, words are a problem in this field. Words are a problem in any field that's emotionally charged, right? Because people read between the lines, and there are connotations. So I never talk about immortality. I think it's a misleading word. It talks it implies that we're going to fix all causes of death, not just aging, which is nonsense. Um, I mean, we will bear down on all causes of death progressively. We'll have self-driving cars that are safer and things like that, but we're never going to have a zero chance of death. So it's just an inappropriate word to be using. Um, and you know, uh, calling aging a disease again, I mean, is it a disease? If you call it a disease, then people think that there's gonna be some one-off treatment, like curing an infection, such that you don't suffer from aging ever again, unless you get reinfected somehow. That's not going to happen because aging is a side effect of being alive. So we're going to have to think about it and treat it in a preventative maintenance manner. But then if you say aging is not a disease, then people also, overinterpret that and they'll say, well, therefore it's off limits to medicine, even in principle, and therefore we shouldn't be trying to develop medicines to fix it. So, you know, if I ruled the world, then it would be illegal to use the word aging and the word disease in the same sentence, because whatever you say relating the two things just is counterproductive. So I think it's okay to call aging a medical problem. I do that. That's kind of a bit better. Uh, Also, it doesn't matter whether, for example, the FDA classifies aging as a disease officially. It doesn't matter. What the FDA cares about is whether they can do clinical trials that have a clinical outcome that's good, right? And that can be, you can actually say um, in a clear black and white way whether the trial achieved its clinical endpoint. And they've got that already. We've even got clinical trials whose clinical endpoint is defined as essentially aging in all but name, and that have been rubber stamped by the FDA. So this is a non-problem.
Well, one of the only good things that I can see with the rise of the billionaire oligarchs, at least in this nation, is that so many of them do fantasize about immortality. And if that's the case, well, it is the case, I would think that some of them, if not many of them, are going to be putting billions of dollars into research for immortality, which is going to have a side effect on your research, not so much for immortality, but the work that you are doing. So I'm hoping that these oligarchs with all this disposable income will somehow, even though it's not their main goal, provide the funds for the research that you and others are doing for what I call a much more realistic approach.
Well, so first of all, you're wrong about the realism aspect. I have the good fortune, since I'm a prominent person in this field, that I get to talk to those billionaires you're talking about, or at least some of them, and they don't think about immortality any more than I do. They think about, indefinitely indefinitely postponing the health problems of late life, which is exactly what I think about. So that's not it's the same research we're talking about. The only difficulty is when you get to the next stage of deciding actually what research to do. And for whatever reason, even though, as you say, the wealthiest people in the world are a lot more together about this than your typical person, a double-digit percentage of the top 50 people in the world probably have started putting money into aging research. Um, Nevertheless, they do it wrongly. They they make the first step. They decide, yes, aging really is the world's worst problem, and yes, their money can make a difference. But then when they decide how to spend their money, they just trust their own gut feeling. They don't actually take the advice of anyone who actually knows a bit about it. It's extremely frustrating. So I'm trying to fix that, but it's hard work.
I'm sure it is. I would think that if even one of these richest 50 people gave you all of the funding that you needed, be having a very different conversation right
Well,
now.
you're damn right. And the worst of it is that the funding that's needed is tiny. Clinical trials cost a lot of money, and we're going to have to do a lot of these clinical trials. So that's kind of beyond the scale of what even the top wealthiest people in the world could do. We need governments to get involved. We essentially need a COVID scale war on aging. But the question is how to trigger that war, how to get governments to start behaving the way they did in relation to COVID. And of course, the way to do that is to get the public to behave the way that they did in relation to COVID, to actually care about it, right? To actually think aging is the new COVID. So I believe that if all the world's top influencers started to say that, then that would be enough. That the public will fall into the line the way they always do when influencers do their influencing. And so, we're not talking about very many people. We're, Oprah Winfrey, Mr. Beast, Joe Rogan. And these are people who are already interested in this topic. Oprah Winfrey's had regenerative medicine specialists on for many years. Rogan's had me on a few times, and various other prominent gerontologists. Mr. Beast talks about aging every so often and says he's not in favor of it. So this is all progress. So the question is, why are they not going the extra mile and saying, listen, everybody, let's have an actual war on aging? The reason is because they are not yet convinced that it's going to succeed, that this is actually something that's doable. And that's because of what I said earlier when I was deprecating all my colleagues in the field who are not courageous enough to come out and give time frame estimates and so on. So that brings me to the experiments that LEV Foundation are doing, these rejuvenation experiments on mice. If we were to get to robust mass rejuvenation, a trebling of the effect size that we can do today in terms of how long we can postpone the aging of middle-aged mice, then all the experts would come out and say, you know what, we're in a new world. Now is the time for a proper war on aging. And when they say it, the subject matter experts, then the influencers will say it. So basically, if you're a billionaire, all you need to do is give me and other people the chance to get to robust mass rejuvenation. And I estimate right now that we've got an 80% chance of getting there with just a few more experiments of the sort that I've been doing at LEV Foundation already, which means we're talking like $20 million, not billion, million, $20 million. It's an absolute pocket change for these people. And that's all it takes.
Well, I'm convinced that if anybody could convince them, you can. You really are an excellent spokesman for the anti-aging research, and I hope that you do convince the billionaires and governments to see the advantage of this and to get the public interested in this and give you the damn funding that you need. To be honest.
Yeah, we won't convince governments directly because governments have one goal in life, which is to get re-elected. They will only do what the public says they should do. We
Absolutely.
won't convince the public directly either. I've been trying to do that for the past 20 years. And, you know, I've brought a lot of people into the field. I've done a lot of community building and everything, but still what I call the pro-aging trance is very entrenched. Almost everybody still regards aging as some kind of blessing in disguise. So, the only way to convince the public is to convince the influencers. And the influencers want to carry on being influencers. And the way they do that is by not being wrong. So that's why they listen to the subject matter experts.
And they will continue being influencers if they live a longer, healthier life, which comes back to your research. So listen, we're going to have to leave it there. I'm a fan, and I know, and I told you at the outset of the interview, I'm going to mispronounce words and get some of the concepts wrong. But that's why I had you on the episode. Thank you so much. I wish you the very, very best. And with social media being what it is and influencers exploding all over the planet, I believe your message is getting out much more than it was 20 years ago because social media has exploded so much in the last 20 years. So good luck to you, Aubrey. Your research is invaluable. It really is. So I wish you the very best. You take care and carry on, please.
Well, thank you very much. Thanks for having me on the show. Hope we reach some billionaires this way as well.
Absolutely. Thank you so much. And you take care and stay safe.
Thank you.